The Nehawu National Office bearers revealing that a marathon of engagements with the employer has failed to yield any positive result, a move that will see the nationwide demonstrations over wages intensified as they accuse government of being arrogant.
With this arrogance displayed by government, it is important to confirm that Nehawu continues with the strike in a more intensified manner as from Monday, the 13th March 2023. To demonstrate to government the seriousness with which we take the concerted efforts to underplay the role and the significance of public servants who are at the coalface of service delivery. We have a duty to protect and defend collective bargaining and the rights of workers in the face of the employer's drive to degrade and break it down.
Nehawu says the workers are protected by Section 23 of the Constitution on the right to strike, noting various court interdicts against the nature of the demonstrations. It says government avoided earlier proposed talks on how the strike will take shape.
It's not us who have a responsibility to make sure that the hospital are functioning as government, but we do, because given our orientation as Nehawu, we realize the impact of our strike in that service. So that's why we then arranged that kind of a meeting so that we can find a way of balancing the service on one hand and the right that must be exercised. But unfortunately, government showed us a middle finger. They have told us directly in writing, others in meetings, that it's not their responsibility to ensure the functioning of hospitals. And that's an unfortunate situation, and we needed to exercise our right. That's the first point that we want to make as a response. The second point, we have issued a statement consistently as and when the leader of Nehawu is interviewed, because that question is not new. We have always been responding. Even yesterday, formally, we have responded that all departments in provinces except Northwest, they've interdicted not the strike, they've interdicted the activities associated with matters of intimidation and so forth. And we have called our members to comply or to work within the framework of those interdicts while continuing with the strike.
The union has also slammed claims by the health minister that 4 lives may have been lost due to the strike action by Nehawu, saying they reserve their rights as they await proof.
The comments of the minister and the disparate attempt to link the loss of lives to the strike of the union, we know they're going to do that thing because they are a state. That's what states do in their quest to defeat workers and crash the strike. Not only they will intimidate workers on dismissals, no work, no pay, they will use courts, they will use police and soldiers, but also they will use propaganda machinery to turn the public against the striking workers. They are determined, as we are saying in our statement, that never before have ever seen a very determined and committed state that wants to defeat workers.
Nehawu says the Labour Appeals Court will decide on the legality of the strike action, but they are hopeful that interventions from the new Minister of Public Service and Administration, Noxolo Kivid, will bring the workers and the government together.
In her 3 days in the office, she has not personally showed us a middle finger or pushed us away. And she understands the issues we are raising. She knows them. She can see that it's not somebody that you are just preaching something that doesn't understand. She understands what we're talking about. But we understand ourselves that she come into a system that has been here before, that has been hell-bent on defeating workers.
The Nehawu leadership has urged their members to remain steadfast as the demonstration enters week 2. They vowed to intensify demonstrations, looking for a positive and favorable outcome coming from the Labour Appeals Court. This as other unions from Cosatu will also be joining in the withdrawal of labour and the downing of tools this week. Katlego Lohodi, SABC News, Braamfontein.